Hello, and welcome to a special recording of Revealed with Dr. KP. I am Dr. KP, your host and your friend. On Revealed, if you don't know by now, you should, but if you don't know by now, Revealed is a show where you talk about your plastic surgery journey. We go through the highs, the lows, the ins, the outs, the good, the bad, the pretty, and the ugly, all just to understand and empathize with you, what you went through, to be educated by you, and to really get to know kind of what plastic surgery looks like from all points of view. Normally, there are 3 ways that you can join us here on Revealed. One is you can actually come on the live. We are a live show every third Friday of the month, 4 p.m. Pacific, 7 p.m. Eastern, 12 a.m. West Africa time. You can join the comments normally. You can still comment below on this video, but you can normally join the live chat that's happening and leave a great comment, and I do mean a great comment. We are about uplifting here, not denigrating, not bashing people, places, or things. And so if you cannot uplift, then shift. And then lastly, you can always like and subscribe to this channel and to the show as well. So without further ado, I'm going to bring on our special guest for today. We have Zoe here, who's going to share her story with us today. Hello.
Hi, how are you?
I'm good, thanks. And thank you so much for making this time to come on to talk about your story.
Of course, I appreciate you asking me to be here.
So without further ado, let's go ahead and jump into this, because I think your story is pretty compelling.
Yeah.
So I saw you on YouTube and wanted to talk to you more and have a conversation with you more about what you went through. But to kind of give everyone a chance to get to know kind of what happened. First, the question is, what have you had done?
I got Lipo 360 and fat transfer to my butt. Yeah, I think that's pretty much what they call it.
Yeah. And
Yeah.
what kind of what made you decide that that was kind of the move that you wanted to make for yourself?
Well, to be honest, I have, since I was very young, always had like body issues, and like in my culture it's very normalized to get plastic surgery. So um when I had the money, I had money saved up, I thought to myself that that's what I wanted to do. I spoke to my mom, my sister, and everyone was like, well, if that's what you want to do. There were certain people who tried to talk me out of it, but like I wanted it really bad, so I did it.
Fair enough. Fair enough. And okay, I don't want you to give any names, but can you describe to us your surgeon?
He was he's a pastor. um he was different. Like, he wasn't rude, but he was very assertive in the way he talked. I remember when he saw me without my clothes, like the very first consultation, he was like, you have an okay body. You just need your butts lifted a little bit. Like, he didn't like make me feel like I was less than or anything. But I do remember like feeling a little scared on the day of the procedure, and like he came and he got me and he was like, everything's gonna be okay. But this is what you wanted. So it was just kind of like sweet and sour vibes. So yeah.
Was it sweet and sour basically from the time you met him, or it was sweet initially and then it like turned sour at some point?
I think just every interaction had a little bit of both sweet and sour. Do you know?
Okay. Okay. And at the time, in hindsight now, do you think that's what you needed? Do you think you wanted more of a vibe with him? What do you think you needed from the surgeon in terms of like his working relationship with you?
Yeah, I think if I could be honest, I there's just certain things that I remember that he said that are not appropriate, but I also wasn't in the
Mm,
United States, so ethics are different.
mm,
So
mm.
I think because I have lived in this country most of my life, I know that that's not how it should be within the ethical realm of, like, how doctors should speak to their patients. But I don't know, I feel like it went the way that it needed to. I remember I didn't want to be out and about for my massages. So he found me like a home nurse, and he found me a massage therapist to come to where I was at. So he was very helpful.
Mhm.
It's just like, he didn't use meds. He didn't put me to sleep. I had lost a lot of blood. He wouldn't give me any blood. So it's like just certain things that I'm like, it could have been a little different.
Yeah, there's a lot that you said, so I want to try to pick it out. Okay, so one of the first things you said was one, you didn't get it done in the States,
No.
but you live in the States.
Yes.
Okay. Um, what made you decide to leave the States to get it done?
I planned on initially doing it here, actually in
Mhm.
California. And I
Mhm.
had a consultation with a doctor, and I really wanted him to do my surgery. But when I had the consultation, he literally quoted me maybe $800 less than what I had in my account. It was literally like $37,500 to get it done here. So I was like,
Okay.
I don't want to spend everything that I have for the surgery because there's still so much aftercare. And so I decided to I was going back to where I was born anyways. That's the country I was born in, Dominican Republic. So I just decided to go there and do a consultation there. Um, so that's the reason why I chose to do it outside of the country, but it wasn't my initial plan
It wasn't okay. And how did you end up finding the surgeon?
because I have family out there. And so
Okay.
my cousin, he is a AI tech person, and he did a
Uh-huh.
couple doctors offices, like made it technology, like, you know, and
Yeah.
he asked the doctor if he knew anybody that he could recommend for my surgery. So I had a consultation with that doctor, and he asked me, what did I want? Did I want to look natural? Did I want to look like, you know, like he asked me a whole bunch of questions, and then he recommended two different doctors to give me two different looks. And so I met with
Okay.
them, and my mom really liked the pastor because she's really religious. It didn't make sense to me, but that's what we went with.
Okay. We went with. So you feel like did your mom have a lot of hand in you choosing the pastor ultimately? Do you think?
I think so, yes, because she really liked him. Um, but she picked him, and then she left. So that was I met him in February, and my surgery wasn't until I met him in January. My surgery wasn't until March 26, 2021.
Okay.
And my mom left in February. So she didn't come back until the day of my surgery, and then she left 3 days later. So she wasn't really in like the pre-op appointments and like the meetings with him I had in between. So
You were in DR. Were you in DR from January until basically after your
May.
surgery?
I was January till May.
Okay. Okay. So that's different than what I usually say, right? Because most people, I think, when they hear I went to DR, they hear someone literally got on the plane the day before, went to DR, got on the plane after doing a crouching pose, hitting dragon, crouching dragon, or whatever the thing is, um, and they're on the plane, and it's a whole plane of women who are traveling back post-op day 2 from their BBLs.
Yeah.
So, and what I say is, if you are going to choose a surgeon who is not near you within 10, 20, 30, even an hour distance from you, then you need to plan to stay in that place for at least 6 weeks after the surgery, so
Yep.
that if any complications arise, you are near the person who did the operation in order to get those addressed. So I think
Yes.
that's very different, and I commend you for that.
Mhm.
Okay, going back, going back some. He didn't give you any medication. Can you clarify what you mean by that?
Well, honestly, I was awake for my entire surgery. So,
Okay, like
um,
awake, like you were super super aware of everything.
yes, I had gotten an
Okay,
epidural. That's how he did it.
okay,
So
okay.
I got an epidural, and then I had my surgery, and then the meds I got were like a really strong ibuprofen, and I could have it like 3 times a day. And when that wasn't enough, my home nurse bought like ibuprofen suppositories,
Hmm.
but I didn't have any meds. And so not only was I like super low on blood, like I couldn't be like in an erect position, but I
Hmm.
was also in a lot of pain. A lot of pain.
Did you know before the surgery that that was the plan, that you would basically be on Tylenol and Motrin after the surgery?
No.
Okay. Did you know before the surgery that it was going to be completely awake with the aid of an epidural?
No. I specifically told him I didn't want to be awake
Oh, you did. Okay, so you did communicate that. And when you said that to
prior.
him, yeah, when you said that to him prior, what was his response?
I remember him saying like, "It's okay, you'll be fine, you'll be fine." Kind of like not saying that he was gonna put me to sleep, but not saying that he like wasn't. Like it was just kind of like, "You'll be okay, everything's gonna go fine."
Yeah. So as a surgeon, I've been there, right, where a patient is really anxious and you want them to understand that you will do your best by them, right? And so I do understand someone saying you'll be fine, you'll be fine, you'll be fine. But there are two different things, like it's two different things to be like you're going to be awake or you're going to be asleep, right? And if my patient says to me, I want to be completely asleep, and I am saying you're going to be awake, there needs to be a come to Jesus moment where we're both like, okay, I'm going to be awake and I'm okay with that going into the day of surgery. Not that I learn at the time that I'm about to get surgery, hey, we're doing this awake, right? But that
Yeah,
we
I
had an
absolutely
understanding.
had no idea. I had no idea until um I was sitting and all of a sudden I feel like and they're like, "Don't move, don't move." I didn't know what was going on. They weren't like, "Okay." I feel like I'm used to like, okay, there you're gonna feel my touch, and then we're gonna do. There was no breakdown. It was just like getting done, and so
Yeah. Yeah, I feel like two things I'm not really happy with. I'm happy that you are here to share your story. I'm happy that ultimately you had a good result. But I think the two things that I'm not happy with are you basically felt like you were surprised. And there may be surprises after the surgery about how much the pain is, about how healing goes. Because people, as much as we can tell you, like it's gonna hurt
Mhm.
and things will suck for weeks, no one actually prepared you enough to be in that kind of pain, right?
Mhm.
But there should be no surprise about the process to get there, to get to the result. Like you will be asleep for this amount of time, and you know and then we do it, and then you go home or you stay or what have you. So that bothers me. um the other thing that bothers me is the idea of talking to you and not really being gentle with you, right? I'm an African, right? So I get that there are cultural differences.
Mhm.
Right. I remember I was in Ghana for a month when I was a medical student, and this guy had cut his finger in a bread slicer, and the surgeons were doing the procedure awake to reattach his finger. And he was in pain, and they said, "Don't be a baby, you're fine." And so, and that was it. So I get the cultural differences, but I think that irks me too, is that we also understand there's a culture of medicine too, right? And so no matter where we are in the country or in the world, really, that culture of like wanting to be gentle with people in their most vulnerable moments
Right.
should not be lost.
Yes.
So pause there. You talked also about payment and the payment being so different. So you were going to pay 37,000 in California. What did you end up paying?
I paid a little bit over 12 for everything. So it wasn't just the surgery, like everything. The meds that I did get, the nurse, the massages, everything. So it was a huge difference, but I also literally got what I paid for. So
Mm, mm, mm. If you were to do it again, would you have come back to California and paid that 37,000?
no,
Would it have been worth it for you?
no.
No.
Yeah, I know that sounds crazy, but no, I wouldn't.
No,
Because
it's
as
real.
I sit here before you, it's likely that like not as likely, but I do often have thoughts of like, oh, I could do it again. I could, I have to maintain my look, or, so I do have those thoughts. And if I could do what I want 2 or 3 times and pay what it would for one, then I'm like, oh, that makes sense. But I know it sounds crazy because you're like, not you, but like people often say, like, especially on my video, they're like, you almost died, like you're so vain. But it's like, everybody has their problems, you know what I mean? Like
Mm-hmm.
everybody has
Mm-hmm.
their issues, and I just I happen to want to look good, but people have other stuff going on that they also should, quote unquote, shouldn't be doing, or like that's not right. But I can be honest.
Yeah, no, I understand that. It's real. The
Yeah,
money part is real, no matter how you slice it.
yeah.
I do always say you don't want to cheap out on your body and your health. But I do understand that paying 37,000 for 360 lipo and fat grafting to the buttock and hip, that is a lot. I don't know what my patient coordinator would know what my pricing is, but I don't think it comes up to that much. I hope it doesn't. I think that sounds like a lot. Um, you kind of touched on what you expected before, but what were your expectations going into this process?
Well, I had a lot of stuff planned. I had bought the fajas. I had all the, like, I had bought arnica. I bought a little pillow for my butt. Like I had everything I thought that I needed, but I just feel like there's certain things, like you do need your faja, you will need the foam boards, like there's certain things that you need, but there's so many things that I literally just laid on my stomach for months.
Mm,
So going into this,
mm,
I knew it was gonna be painful, but I wasn't ready for how painful it actually was because I didn't expect to be completely pain, like no pain management. So
right.
it was just more than what I thought. A lot of the supplies, like obviously they're nice to have, but you really will, you know, you really will just be laying there recovering. Like there's not much to do. You could get the pillows, but I didn't want to sit. Like I wanted to just lay, because I couldn't,
Yeah.
my blood, like. So
Yeah.
I just expected a quicker recovery. I expected less pain, and I
Mm,
expected to love my body when I woke up, but that was
mm,
that was not smart. It took me, my surgery was March 26th, and I remember I left DR May 14th, and I was still very upset with myself for making the decision. There was a lot of regret up
really?
until, yeah, up until like maybe this time, maybe like June 17th, 2021. I was like, oh, this looks
So,
nice. Like I could wear this, I can wear that.
yeah.
But even still, like then your pants fit you, but they don't fit you. Like then it's just like everything changes. So it's a new
Yeah.
falling in love with everything.
Yeah, you have to fall in love all over again with the new version.
Yeah.
In terms of your ultimate result, do you think he respected what you wanted and gave you what you wanted?
That's a really good question. I remember when he was like putting the marker on my body, I said to him, "Hey, don't forget that I want my hips. I also want my hips bigger." And he had
Hmm.
forgotten. So if I wouldn't have reminded him, then he would have forgotten. Um
Yeah.
but I think overall he did. It was a very aggressive lipo. It was very aggressive. Like when I look at my body now, 4 years later, I realized like there were certain things that he did that were so completely unnatural that was never going to be maintained because a body does not do that. Do you know what I mean? So it was like
Yeah.
I was just like, I have like a wider upper back that goes into like a waist, but he
Hmm.
suctioned all of this up here too, so it's just not something that was sustainable. And
Right.
so I find myself comparing myself to that girl, but that was never, you know. I think he did the best that he could with me, but there was a lot of nerve damage. There was a lot of unsustainability, but I guess in some cases that's to be expected because that's what I did. I did something to my body that's unnatural. So,
Mm. Mm.
yeah.
Mm. Um, what okay, so thinking about them at the around the time of your surgery and them now,
Mhm.
what were your family's opinions about, what was happening and what ultimately you got done?
Yeah, I remember a lot of people saying like, "You don't need that. Like, why would you do that?" People saying you're so pretty, and I'm like, I never said I was ugly, like So, um, but I remember my mom like when I got really sick and I couldn't stand and I was losing a lot of blood. I remember her saying like, "You're in death's arms. You did this to yourself. Look at what you did."
Mm,
So a lot of people had opinions, and I was already experiencing my own regret, so it made it harder. But
mm-hmm,
you know, there was I had to stand in what I did because there was no going back.
mm, mm.
Yeah.
So I am not from a gentle parent, and I imagine that if I did something, and well, I not imagine, I know that if I had done something of my own choosing and then the result didn't work out, that she would basically say, "Well, I told you so. This is what was going to happen."
Absolutely.
Um, so I so I do. I'm with you, girl. Like I feel you.
Yeah.
Um, it sounded like in that moment though, you wanted something a little bit more gentle because you really felt like you were in hell, and so you needed
Oh
something a
yeah.
little bit gentler to just to get you through that.
Oh
At
yeah.
any point, was there someone who was that person for you, or you felt like you really this was a solo mission completely?
Well, I the way I planned it out because I had spent so much less money, I also bought my mom, my sister, and my best friend flights to come in intervals to come see me
Okay.
because they work, they have children, so it's like they
Yeah.
can't always be there at the same time. So my mom was there with me for day of the surgery, day after. My sister got there day after and stayed for a week, and then a week after my surgery, my best friend showed up and she stayed for a week. So I would say um, my mom did the best she could, but she couldn't be supportive. She doesn't have that in her, but it's not any fault of her own. That's how she was raised too. So it's kind of like, but my sister and my best friend were amazing supports. My sister saw me through the worst of it because it was literally the day after me leaving the hospital. I couldn't stand to shower. I couldn't eat. I literally have never ever wanted to die except for that day after. Like it was so bad.
Mm, mm,
I was like, yeah, this is not it. But my sister helped me through a lot. I mean, I when I had to pee, I couldn't stand to pee either, so like I couldn't wipe. So she was very supportive. And then by the time my best friend came, I was doing a lot better. I was able to
yeah.
walk,
Yeah.
watch movies. So yeah, I think I got what I needed out of the people that have always been that for me, but
Mm-hmm.
not out of like a medical team. Like not even like the nurses my mom hired. Like they weren't like the worst, but they weren't like warm. Like I didn't
Mm,
want to eat and they'd be like, "You have to eat." And I'm like,
mm.
"Well, I didn't want to shower." They're like, "You must shower." And I'm like, "Yeah, please." It was hard to get up. It was hard to keep, but
Yeah. Yeah. And trying to thug it out with the tough love can be a little bit hard to do when you feel like
everything's
I've
already tough.
literally yeah I'm done. I have no more energy for this. I
Yeah,
literally have no energy for this.
right.
Um, Going back because you've said a couple of times now, blood loss and feeling like you couldn't stand up. Um, so typically, a large amount of blood loss is not associated with 360 lipo and BBL. So can you speak to kind of what your experience was with that?
Yeah, I honestly didn't know. Like, I don't know. The doctor never talked to me about blood loss or anything, but I remember he did say I needed to like walk. When the nurse called
Mhm,
him, once I got moved from like um the recovery room to like my regular room, he
mhm,
said, walk her around the room. And when I got up, there was just so much blood flowing off of me, but I don't know why? I don't know. He was never there. So she laid me back down because I told her I can't see and I can't hear and I'm gonna pass out. I remember getting sick that night. And then from that day all the way up until maybe like a week or 8 days after, I could not be in an erect position. I had to be
mm,
sitting or laying. I could
mhm.
not stand because my body could not keep me awake. Like if I stood up, I would pass out. And I don't know. I just couldn't. I couldn't. I showered sitting down. Everything that I did was in the laying or sitting position. And I didn't
Yeah.
sit because I didn't sit for like the first like 3 weeks because it was painful to sit.
Yeah.
So
Yeah.
I was just laying on my stomach, which also had five. I had 5 stitches in the front, 5 stitches in the back. So it wasn't non-painful to lay on my stomach. It just wasn't as painful as
As
my butt.
painful as the back. Yeah.
Yeah.
I know that you hired nursing to be with you, but was there any point in which you felt like this can't be normal and you wanted to reach out to the doctor? Was that possible?
I could if I wanted to, but he did when I left the hospital. He did prescribe me iron, like liquid iron. So they were giving
Mm-hmm.
me iron in my IV. I had an IV in even after I left the hospital because the
You
nurses
did.
that my
Okay.
mom hired were nurses he recommended. So
Okay.
they were like his nurses. So yeah.
Okay. Okay. But you didn't feel like you had to call the office and just ask, like, hey, am I really doing okay? Because this doesn't feel great.
No, I remember him coming in the day he gave me the iron and he was like, this is normal. I'm going to give you iron. But this is, I remember him saying, like, this is it. This is what you wanted. This is it.
Okay. Okay. Um, so I think you kind of mentioned this, but would you do it again?
um, it's so bad because maybe for like the first 2 years after, I was like, no, I would never do it again. But now it's like, I don't know. I feel like I would, but I wouldn't do it with that doctor. I would
Okay.
need meds and I would not touch my butt anymore because my butt is huge. Like I would probably do something different, like maybe lipo and like my boobs or just
Yeah.
lipo. Like I don't know, but it's not like I'm like, oh, not big enough, needed bigger. Like I'm not on that side of plastic surgery. I'm just like, oh, like maintain vibes, like
Yeah.
but I'm not, I'm in the mindset right now of like I want to buy a house and like, so my money is not, anchored towards that direction. So
Right.
I don't think I would do it now. But maybe.
Fair enough. Fair enough. But the key is that you don't think you would go with that same surgeon, not the
Oh,
way that.
absolutely not. Absolutely
Okay.
not. I think
Okay.
I would go, honestly, I think I would have loved if it was a woman, mostly because like I feel like it's more understandable. Like I just didn't feel like compassion or like understanding of like me, like as a person. Like I know it's like vain and like whatever, but
Mm,
I just didn't feel that connection from him. I
yeah.
wouldn't have chosen him to begin with. But
Mm,
I don't want to say it wasn't my choice, but I don't know, like in my culture, like you're like my mom is like, okay, like this is a good one, so you have to go with him, and
yeah.
he's the pastor.
Yeah.
So I'm like, okay,
No, your mom
you
is
know,
your mom is the wise one. He's a pastor.
yeah,
If anyone's going to take care of you and treat you like their own and treat you like, their neighbor, it's going to be presumably a pastor, right? Who's also a plastic surgeon. So, do you know his credentials? Like, is he an actual board certified plastic surgeon or what
he
are
is.
those? Okay.
He well, this is based off what I saw in his office. I was in his office a few times, and he studied in Mexico,
Okay.
and yeah, that's where he practices in DR, but that's where he studied and he did all his like stuff. I saw a lot of different stuff on the wall, but I never like researched or like anything like that. No. But I do remember going into my appointments and like my follow-up appointments and seeing other women like in the waiting room who had the surgery day before, day after, same day as me.
Mhm.
And they seem to have different experiences. So I don't know if he chose to like not give me medication or what, but I remember sharing with them like, oh, this is terrible, whatever. They're like, it's not too bad. But I was the only one in that entire room that had just had lipo. All of them had tummy tucks. So I don't
Okay.
know if it's just that lipo is
Maybe he
extremely
changed the
painful.
protocol for them or something like that.
I don't know. I don't know.
Yeah.
I'm glad
Hard
I
to,
didn't get a tummy tuck though, but yeah.
hard to know. If your daughter or son asked you to basically have this done, what would you say to them?
Well, I don't have kids, but I think that the honest truth is that, like I said earlier, this is, I don't want to say it's a problem, but it is a decision just like any other. Um, it's a it's a vanity like any other. You could tell your
Mhm.
kids don't smoke, but either they're gonna smoke in front of you or they're gonna smoke with their friends. You know what I mean? So if
Right.
you're smoking, tell me you're smoking, and don't do it
Yeah.
somewhere where you're gonna get in trouble, right? But it was nothing that my mom could have told me to keep me from doing it. She just could have not
Mm,
supported me, and it would have been a little harder because I didn't have my mom. But I
right.
I can't keep anything that I love from doing something that they want. People have to
Yeah.
learn these experiences on their own. They just do. So yes, I would say, "Hey, do you want my opinion? Let me tell you my story." But you can't keep anybody from something that is tugging at them. You just can't.
Right.
They have to
Right.
do it, learn, and then to say, "Oh, wow. You were right." You know? So
Fair enough.
of course, I would love to keep them from experiencing the pain that I experienced, the regret that I experienced, but that's not possible with human behavior.
Right. No, I totally agree. And then lastly, what lesson did you learn from this, and what lesson do you want to make sure that everyone else understands?
Well, I know I said what I just said, like no one can stop you, but I do want people to know that there are so many times where I think about my body and the body I was born with. And I ask myself like why couldn't I love that? Cuz I look back and I'm like damn that wasn't so bad. Um so the yeah, I could have died and that would have been really bad, but I died anyway. Like I killed off parts of myself I'll never see again, and I had to
Mm,
fall in love with a whole different part of me. And it's not it's I don't know, like I don't want to say it's not worth it. It's just it doesn't take away the problem that I have that many other girls have where it's like it's never enough. You know, like
yeah.
it's mental. You know what I mean? I could still have the body I got the day after the surgery, or after I got off being swollen, but I would still want more because it's not physical. You know what I mean? It
Mm,
doesn't go away. That feeling of like, oh, what if it doesn't go away? It just
yeah.
gets stronger because now you know what's possible. And on top of
Yeah.
that, you will
Yeah.
never ever you don't really forgive yourself for like for killing off a part of you that you'll never see again. You
Mm.
know, like, you know, I don't know. Does
That's
that
a
make sense?
bar. I had never thought about it that way. I'd never thought that
Yeah.
in getting a cosmetic operation or some kind of transformative operation like that, that some part of you has to die and a new part emerges
Yeah.
that will never be a replacement for the part that you lost.
Absolutely. And as much as you liked
Um,
it, as much as
yeah.
you didn't like it, when it's gone, it's like, did it have to die? Did I
Mm,
have to kill it? Do you know what I mean?
right.
So yeah, like I like
Yeah.
my big butt, I like my little waist. I'm cool, I'm happy, but I remember I think about the little girl in me all the time, and
Mm,
she's alive in me. You remember those dolls? Me and my best friend were just talking about this. You remember those plastic dolls? Like it was a doll inside a doll inside a doll, and when you
yeah.
opened, there was like
Yeah.
little dolls. She's inside of me, and
Yeah.
I some of those dolls and a lot of those dolls are gone now because I've at least the physical part of them, and
Mm,
it's just like just the same thing. It's sweet and it's sour. If you're gonna
mm-hmm.
do it, but just know it comes with a whole lot of sour, and
Mm.
the sweet just comes in like little glimpses. Cause a body is just a body. You still got to deal with what's going on up here.
Right. And I think that is where plastic surgery thrives, right? That the up here part is not fixed. And so we just encourage people to get plastic surgery to address the insecurities that they have. And
Yeah.
I'm not trying to villainize the whole profession, but I think we have to keep it real that I wouldn't exist as a plastic surgeon if there wasn't some kind of standard or normal that we
Societal
had.
pressure.
Exactly, societal pressure that we had that creates this internal voice of like, what I got isn't good enough, or what I got doesn't meet the standard.
Mhm.
And so that is my insecurity that I have to deal with. But hey, by the way, I have a plastic surgeon who can do that for me and get me closer to what the standard is.
Yeah.
And then we kind of just reinforce it, right? Because we
Mhm.
reinforce what the standard is:
Yeah.
cute
Once
pixie
you do it
noses,
once,
big
you
butts,
know you
small
can do it
waists.
again.
Yeah,
Yeah, and I
exactly.
remember going in for my last visit with him, and he said, "You look good. Look at you. You look great. We got to do your boobs now." And
Oh
I was
no,
like,
really?
ah. Yeah. I was like, oh.
Really? Oh, goodness.
Yeah, it was wild.
Wow. We got to do your boobs now. That's
Yeah.
crazy.
Yeah. It was
Okay.
crazy.
And
Yeah.
and
Well,
okay. And I think if you were a person who didn't have kind of the gumption to be like, no, I'm good, you would have been like, okay, let's talk about what that looks like. What does breast augmentation or breast lift or whatever look like now? Yeah, that's not okay. Do you think this is the real last question? Do you think plastic surgery is addictive?
oh yeah. I mean, I got a procedure scheduled. It's not like surgery. It's definitely outpatient, but I'm already doing something else. And
Okay.
yeah, like I'm like, oh, things are easy, things are quick. Like if you have money, you could just not fix it, but sometimes I'm like, oh, that looks cute, that looks fun, So yeah, I think so. I would say so. And it's worse than tattoos. People say tattoos are addictive. Mm-mm.
And maybe comes with more pain too.
A lot more pain.
Well, thank you again so much. I really appreciate you taking the
Of
time to
course,
do this. I think this was very informative. Your story
of
is
course.
truly, truly compelling. And I like that we were able to kind of touch on all the nuances from the beginning to the end and bringing it back. So thanks again
Yes,
for that.
yes. Thank you so much. I appreciate being able to share, and I hope this helps somebody.
No, I think it definitely will. I think it definitely will.
Awesome.
Okay. Have a great day.
You too. See you soon. Bye bye.
Yeah, bye. So thank you again, Zoe, for sharing your story. That was beautiful. It was really beautiful to be able to have the distance and be able to have all the insight that you did have. And the bars that you provided us, I didn't even pick up on all of them, but certainly people watch the whole interview and catch all of the greatness that she was sharing with us. If you want to be a part of the live, please join us this Friday at 4 p.m. Pacific, 7 p.m. Eastern, and 12 a.m. West Africa time. And you can join us every third Friday of the month, whether you want to share or be shared with. We are here for you live and direct to hear your stories, to share your stories, and to learn from your stories. And so, with that, I will say like and subscribe. As always, love you lots, and bye for now.